So what happens at the end of 9 months when the mother has reached full term?
Parturtion.
What's that?
Parturtion means the bringing forth of young, or more simply,
Birth.
yes, there's a series of events that occurs, commonly called labor. Now, the precise explanation for what triggers the onset of labor isn't well understood, but it's certain that hormones play a vital role continuing the process once it's begun.
So do estrogen and progesterone have anything to do with this?
They contribute a great deal, but other hormones such as prostaglandins, oxytocin, and relaxin also have roles to play.
And what do they do?
Well, prostaglandins are hormone-like chemical messengers that are produced by the placenta during labor. Oxytocin stimulates the uterine muscle to contract.
So let me guess. Relaxin would probably relax the mother somehow.
Right. Relaxin causes the pelvic ligaments in the pubic bone to relax. And that allows the pubic inlet to widen, become more flexible. That allows for an easier delivery. Let's take a closer look at the birthing process. There is a cervical plug, largely composed of mucus. It protects the developing fetus from bacteria and other infectious agents. In 95% of all births, the fetus is in the head-down position. As the baby's head pushes against the cervix, it stimulates pressoreceptors in the cervix. They detect the pressure and stimulate nerve impulses to be sent to the hypothalamus. Oxytocin is released from the posterior pituitary into the blood so that it can travel to the uterus.
And the muscles of the uterus then begin to contract.
Yes, they contract with greater force and frequency. The higher the concentration of oxytocin in the blood, the greater the contractile forces on the uterus. That's an example of positive feedback.
So where do estrogen and progesterone fit into all of this?
Well, they act antagonistically to each other.
Now, that means one stimulates while the other inhibits?
Yes. In the last few weeks of pregnancy, just prior to labor, the levels of estrogen are the highest in the maternal blood. Now, estrogen increases the ability of the uterus to contract. It also lessens the effect of progesterone. Now, progesterone relaxes uterine muscles, so they're not contracting continually and expel the fetus prematurely. As the levels of progesterone drop sharply at the end of pregnancy, this relaxing influence is reduced in preparation for labor.
So with all the estrogen and oxytocin hormones increasing the number and rate of the contractions, the mother should be ready to deliver.
Not necessarily. If the contractions are premature, the mother could be experiencing false labor. When the fetal cells start producing oxytocin, this triggers the release of prostaglandins. Now, all these chemicals together produce vigorous and frequent contractions of the uterus, which initiates labor. Now, at the same time, the placenta is producing relaxin to help make it an easier delivery.
I'm exhausted just thinking about all this. What happens when the mother can't produce enough oxytocin?
She could be administered additional oxytocin intravenously. It's sometimes called the drip.
What do they mean when they say the mother's water breaks?
That's when the cervix has been forced open by the strong contractions of the uterus and the pressure of the amniotic fluid against the walls. The amnion ruptures and the fluid is released, or the water breaks. Once the cervix is fully dilated to approximately 10 centimeters, and the contractions occur every 1 to 3 minutes apart, the baby enters the birth canal and continues to move slowly through the canal until delivery. At this point, estrogen and oxytocin levels are at their highest, and progesterone levels have decreased substantially.
And when the baby has been safely delivered?
Well, there's still one more connection to the mother, the umbilical cord, right?
Right.
Now, it needs to be cut in order to separate the baby from the placenta.
Placenta, or afterbirth, is delivered about 10 to 15 minutes after the birth of the baby. The uterus continues to contract, and that helps detach the placenta from the uterine lining.
Labor begins when the hormones oxytocin from the posterior pituitary and the prostaglandins from the placenta are released, stimulating muscular contractions of the uterine wall. It is believed that the secretion of oxytocin may be triggered by movements of the fetus against the cervix. As labor proceeds and the baby begins to move down the birth canal, more oxytocin is released, which contributes to the frequency and strength of the contractions. This is an example of positive feedback.
A cesarean, or C-section, has become a common procedure in the delivery room. Some say too common. It is the surgical delivery of a baby through an incision in the mother's abdomen and uterus. A C-section is recommended when there's a problem with delivery and the health of the mother or fetus is at risk.